Good evening and welcome to another edition of Medicine in the News. I'm your host, Dr. Lee Radosh. It's January, time for New Year's resolutions, time to make changes in your life. And addiction commonly comes up this time of year. Many people want to kick the habit of smoking, and we actually had a show recently about that. But also some addictions such as alcoholism, drug use. These are so common, and luckily there is a lot of help available. And we're learning more and more about this, the science behind it, the psychological interaction, the chemical dependency, the physical dependency. And we're going to talk tonight about that. And with me is a guest, Dr. David O'Connell. I very much appreciate his being on tonight. He and Dr. Deborah Bovino, who unfortunately couldn't be here tonight, have co-authored a new book that's coming out, and maybe we can show a graphic of that, called Managing Your Recovery from Addiction, a guide for executives, senior managers, and other professionals. And this is a book that's just coming out from the press, from Hayworth Press. And I thank you so much for being on. And in terms of our guest tonight, I just want to point out, when we talk about this a lot on the show, how lucky we are in Berks County to have such resources, such experts. I'd like to say you're a local expert. I'd like to say you're a national expert. But, of course, I'm friends with you and the other co-author, Dr. Bovino, and you guys are international experts really speaking. I've spoken all over the world and Europe about this and these topics. So we're very lucky to have you. So thanks for being here.
It's my pleasure, Lee.
Oh, thanks. So let's talk a little bit about addiction. In your title of the book, it's a recovery from addiction. I think the first thing we need to clarify is, and this is obviously a very difficult question, what is addiction? When is someone addicted to something?
Well, it's a good question because we could look at drug or alcohol use or use of any substance really as misuse or abuse. And at some point it may cross the line and go from taking a substance into the body for whatever reason to where it gets to a point where the person loses control over it. So the hallmark, a defining aspect of what addiction is loss of control. Something becomes compulsive, it becomes out of hand. It's something that the person tries to do, tries to control, tries to stop, but can't. So that's how I would define addiction. I would say that it's the use of alcohol or drugs at the point or at the frequency, intensity, and at the nature where something's compulsive and out of control.
That's great. And also I just want to remind our viewers that if you have a question or comment tonight, please call us at 610-378-0426. We'd love to take your calls. In terms of the loss of control, the other issue that comes up related to this is the idea of tolerance and dependency, and these are words that you hear a lot about when it comes to this. How do these words relate to addiction?
Well, when you take a drug into the drug has an effect on the body, and the body has an effect on the drug. And when a drug is in a body long enough, this could be a medication given from a doctor or any type of substance coming in, the body adapts to it, adapts to its presence, and there's predictable physiological processes that engage as the body takes the drug in, distributes it, metabolizes it, has its effect, and then it's eliminated. And so the words you use, tolerance, one of the words you use is tolerance, is one of the signs that the body's adapting to the presence of the drug, and in that case, more and more drug is needed to get the same effect.
But that doesn't mean someone's addicted if their body's getting tolerant.
Exactly. Somebody could be on a pain medicine and need more and more of the pain medicine over time, possibly could develop physical dependence, which is something, could be a component of addiction, not necessarily defining aspect of addiction itself. But the tolerance would be needing more and more for the effect, but wouldn't necessarily mean that the person is an addict or is an alcoholic or is somebody who's in a compulsive cycle. Another aspect of addiction is continued use of a substance despite adverse consequences. So somebody who's taking a painkiller and then realizes, gee, I'm taking more and more of this, getting less and less of an effect. I think this is something's wrong here. Goes to their doctor and stops it. We wouldn't say that person necessarily is addicted. We might say they developed tolerance, they developed dependence, and it's time to switch to a new drug or new class of drugs or other therapies for the condition. Or it could be for somebody who's not an addict or an alcoholic, a danger sign if they're drinking and they're drinking more and more and they find themselves drinking more and getting less of an effect. could be a little red flag. Gee, maybe it's time to take a serious look at my alcohol and drug use and stop it or do something about it.
And we're talking about alcohol and drug use, and I think people need to understand, too, when we talk about drug use and drug abuse and addiction, certainly marijuana can be heroin, other things, but very commonly prescription pain medicines are really one of the most common causes of addiction, and certainly you see that at the Karen Foundation with your work there. Mm-hmm. Can you comment for our viewers a little bit about that? I mean, that's fairly common.
Yeah, it seems it can happen to the elderly who are on lots of medicines often. It can happen to somebody at any age. But most people who take medicines from their doctor, whether they're tranquilizers or antidepressants or painkillers, usually comply and take them in the right way, and they have the effect on the disorder. If they find themselves taking more and more, then that should be a red flag. And we find that about the same amount of people who take prescribed medicines as the general public show an actual development of the syndrome or disease known as addiction. So psychiatric medicines, when they're given appropriately and used appropriately, are not a problem. But there does seem to be a genetically driven physiological and psychological components to addiction. So somebody who is sort of an addict in disguise, so to speak, takes a medicine that wouldn't necessarily have a negative effect. It may activate the addictive process, and that person clearly is inappropriate to continue taking a medicine if they start abusing it and develop an addictive pattern of use of it.
So it sounds like the message is for people who are on pain medicines for chronic pain or on certain psychiatric medicines, tranquilizers, for the most part, I mean, as long as they're following the doctor's instructions, working with the doctor and healthcare providers to treat the underlying problem, that's probably okay. In most cases, the medicine isn't going to cause an addiction. Addiction is usually caused by a whole underlying issues as well.
Exactly. It's a multifactorial, many components to it, and just simply taking a medicine for a period of time
isn't going to suddenly cause
it's as simple as that. You're exactly right.
And when in your book you talk about recovery and addiction. So we've talked a little bit about addiction, and really you said the hallmark is that loss of control really over your life, and that could be physically, I mean, a whole component of that. Mm-hmm. Then what is recovery? In other words, when, and we'll talk later in the program about getting to there, mm-hmm. but when someone's in recovery, what does that mean?
Mm-hmm. Yeah, recovery is looked at as a lifelong process rather than some kind of end state. People usually say, I'm in recovery, or I'm recovering. And there's a saying in Alcoholics Anonymous, the first thing that one does is put a plug in the jug. So the abstinence certainly is or cessation of the drug or alcohol use is really the first step, the initial step in the recovery process. And once somebody becomes abstinent, there's a lot of changes that happen physiologically and psychologically. And a person who wants to move from just stopping alcohol or drug use and really become healthy and become balanced and become integrated again gets involved with some type of recovery program. The most popular one are the 12-step based programs, or comes into a program like Karen's, or goes to see a healthcare professional to help them through counseling and other adjunctive treatments, which might include even spirituality along with counseling, to move from simply an abstinent state, a state where there's no longer any drug or alcohol in the system, to back to wellness again, back to health, back to balance, and to deal with the physiological, psychological, and spiritual issues which may have precipitated or contributed to the development of an addiction in the first place. So recovery, ultimately, and I have many friends who are in recovery for 20, 25, 30 years, a state of serenity, a state of integration, a state of the highest levels of psychological development, self-actualization that we know of, can actually happen. And people's lives are completely transformed. They may